That's right. No South Mississippi counties under that elective surgery mandate today, but 104 new cases on the coast. Jackson County actually breaking a record with 51 new cases. Previously, the governor and Dr. Dobbs both indicating they are watching what's happening here in South Mississippi very closely. Joining us now, Singing River Health System's Chief Medical Officer, Dr. Randy Roth. Dr. Roth, thanks so much for joining us. This news is, of course, troubling. Let's talk first about what's happening at Singing River, because Jackson County, a lot of new cases there today, record 51. You have a pretty high hospital rate compared to other days we've talked, especially in terms of ICU and ventilators, it seems.
Correct. We have a total of 16 inpatients today. We have 8 in the ICU, of which 2 are on the ventilator. Those numbers are up from 2 or 3 weeks ago. They're still not at our peak. Our peak was about 30 inpatients on or around mid-April, so we're not back at that right now. The vast majority of our positive tests are younger folks that are getting tested because of either had an exposure or don't feel well. The amount of testing has drastically increased over the past 2 to 3 weeks in our system.
With it not being unusual now for the state to see 600 to 900 to 1,000 cases on a given day, how concerned are you about this trend and the direction we're heading right now, or appear to be heading?
Sure, I'm concerned. I'm not really ready to go on the record that we're having that surge that everybody's concerned about. Again, what I follow mainly is hospital days and inpatient mortality. That's my main concern as a hospitalist and a CMO. When I look at our numbers of tests being done in the outpatient setting, the vast majority of our positives never come into the hospital. So we're not bed strapped right now. We obviously want to take care of and conserve our beds and our ventilators, but we have capacity right now to take as many patients, within reason as we need to take.
As you just heard, there are hospitals in the state that are at capacity, and that's why there's this order now from the state health officer and the governor to cut back on elective surgeries in those 6 counties. The governor, when we spoke with him last week, he said that he's going to be watching this area closely too, of course. We're nowhere near that level right now, right, where we would have to do something like that, in your opinion?
In my opinion, we are not. We've done a very good job of isolating our COVID patients, not trying to expose them to our non-COVID patients. The big issue about elective surgery is if your hospital's strapped for PPE or they're strapped for resources or beds, these elective surgeries then take those patient spots and beds, and that's when you have to limit those number of cases.
Dr. Dobbs said today, talking about masks and people not following social distancing guidelines, a lot of people still going to large gatherings, parties. We certainly saw that over the 4th of July weekend, and he's very frustrated. He says there's just no amount of planning to overcome what he called foolish behavior and people acting recklessly. Well, what do you have to say about that? People continuing to, especially the younger population, from what we're seeing, acting like there's nothing really going on.
I'm a big believer in masks. I have mine. I wear it pretty much around the clock in the hospital, except in my office. I think any common areas. I think if you go to a place where you can't predict who you're going to come into contact with, I think masking is more than appropriate. I think we should do that. I think it's a good thing. The reckless behavior that goes on, I don't know how you mandate that. You go and you see 30 or 40 people in a small area. The young folks have to realize that they may not get this disease and exhibit symptoms, but they're going to bring it to their vulnerable grandmother or grandfather or great aunt, and that's who's going to end up in the hospital very ill. So they can be a vector without getting the disease or even knowing they're positive. So I would really get out in front of people and say, limit, limit, limit. We can get past this. Do you really need to have 35 people, in your hot tub every single day during the summer? You probably do not. It's reckless. Please don't do that. And if you're in a place where you can wear a mask out in public, where you're going to be within 6 feet and you can't control your own social distancing, I would recommend wearing a mask.
Right, and again, the asymptomatic cases among young people, those seem to be growing, and there's no way for them to know if they have it and could be spreading it to more vulnerable people. So this is something that we all need to keep in mind. Dr. Randy Roth from Singing River Health System, thanks for joining us today.
Thank you.